Study after study has shown that fewer than 1 in 4 people know how to recognise the signs and symptoms of a potentially deadly blood clot. And the shocking thing is that in the US alone, 274 die every day from blood clots. That's not to mention the people whose lives are devastated by strokes and pulmonary embolisms. Knowing how to recognise symptoms of blood clots can be life-saving. That's why in this video we're going to explain what the telltale signs of a blood clot are, as well as dive into 5 ways to help prevent them from forming. You'll also discover how a certain vitamin could dramatically help improve cardiovascular health. But before we jump in, can you do us a favour and like this video? And make sure you subscribe to Heart Disease Code. Ring the bell for future notifications for more help managing your blood health. And stick around to find out how you can get 2 free gifts. Firstly, it's important to understand how blood clots occur. They are formed when a mixture of fibrin and platelets stick together. It's critical to have a certain degree of clotting as it stops you losing too much blood when you cut yourself. However, if blood clots form when there's been no injury or they don't dissolve naturally, the situation can be serious. There are 2 different types of clots. The first type is thrombus. This is a stationary clot that's attached to a vein or artery and can block blood flow. The second type is embolus. These are the ones which break loose. These are dangerous because they can move to other parts of the body, such as the lungs. So how do we recognise the symptoms of a blood clot? First, let's look at deep vein thrombosis. This is when a clot forms in a deep vein, normally in the leg, and obstructs the flow of blood. The signs of these are pain or tenderness in a certain limb, swelling, red or blue discoloration, and warmth. Secondly, we'll look at pulmonary embolism. This is when a blood clot travels through the veins and lodges in the lungs. It can then block circulation and creates a potentially life-threatening condition. Warnings of this are shortness of breath, difficulty breathing, chest pain when deep breathing, anxiety, sweating, coughing up blood, and feeling dizzy. Other life-threatening places for clots are the heart and the brain. If a clot is on the heart, you may have the following symptoms: chest pain, shortness of breath, nausea, sweating, discomfort in the upper area of the body, left arm numbness, and lightheadedness. Finally, if a clot is on the brain, an indication of this is severe headache, trouble speaking, weakness in face or limbs, dizziness, abdominal pain, diarrhea, and vomiting. If you or anyone you know are experiencing these symptoms, then it's important to get help immediately. Dial 911 or your country's emergency code. So what can we do to prevent clots from forming? We're about to explore the top 5 ways to prevent blood clots, and the first one is a great way to not only help yourself but to also help others. But before we do that, are you ready for 2 free gifts? If you want to learn more about reducing your risk of a heart attack, then why not download our free ebook, The Surprising Truth About Fat and Cholesterol. Plus, get exclusive insights from some of the world's leading medical and nutritional professionals by watching the first episode of The Untold Story of Heart Disease. Both gifts can be grabbed simply by clicking the link in the description below. So go and claim them for free now. The first step to help reduce the risk of blood clots is, number 5, give blood. Giving blood can not only help save someone's life, but it could save your own. This is due to the fact that too much iron in the blood can cause it to become thick and sticky, thus increasing the likelihood of clots. Research shows that women who are still menstruating have decreased incidence of heart disease. One of the reasons is thought to be that they have lower levels of iron due to the monthly loss of blood. This helps decrease the viscosity of the blood as well as oxidative stress. Giving blood regularly can help lower iron levels and provide the same benefits as menstruation. Men and women who regularly donate blood also can benefit from improved blood flow and lower levels of oxidation, thus decreasing their chances of clots. Another way of decreasing risk of blood clots is reducing blood sugar. A great way to help do this is, number 4, stay active. Moving your body helps to lower sugar in the blood. When blood sugar is high, a process called glycation occurs. Glycation increases the stickiness of blood. making it more likely for clots to form. This could explain why clots are often associated with sedentary lifestyles. Long periods of sitting, such as long flights, can often lead to clots being formed. Therefore, keeping your body moving is good for preventing blood clots for multiple reasons. It helps improve blood flow, reduces viscosity of the blood, it helps relieve stress, creates a feeling of well-being, and improves the release of blood clot-dissolving agents. Numerous studies have supported the theory that exercise helps reduce risk of blood clots. For example, a Colorado study took 36 sedentary men, all about 60 years old, 12 of whom were lean and 24 obese. Because obese people are at a much higher risk of strokes and blood clots, they wanted to see how exercise affected a critical blood clot dissolver called tissue-type plasminogen activator. They measured each man's TPA and found that the obese men had 30% less than the men who were at a healthy body weight. The researcher then asked the obese men to walk for 45 minutes, 5 days a week. Interestingly, this resulted in their blood clot dissolving TPA increasing to similar levels as the lean men. Another reason exercise is so important to prevent blood clots is that it can help reduce stress. Stress can significantly increase the likelihood of blood clots. If you think of a soldier in battle, the increase of blood clotting agents serves its purpose. It prevents the soldier from bleeding to death if wounded. However, in modern life, where the battleground is the office, the blood clotting serves less of a purpose. Finding a way to exercise can not only improve blood flow, but reduce stress, especially if you exercise in nature, whether it be in a park, a forest, or at the beach. If you work long hours at a desk or need to take long flights, be sure to move around as much as possible. In the office, take regular breaks to stand up, whether it be to use the bathroom or to get water. On your lunch break, try and take a short walk around the block. During flights, stand up and stretch whenever possible. Next up, we'll discover how a special enzyme can help dissolve blood clots. Number 3. Nattokinase and lumbrokinase. You may be wondering what these are and why they can help prevent blood clots. Both are supplements which have been found to decrease the stickiness of blood. Nattokinase comes from natto, which is fermented soybeans. Fermented soybeans create the enzyme nattokinase, which can be bought in supplement form. Lumbrokinase is developed in Japan and China from an earthworm extract. Both these supplements have been used as an effective treatment to reduce the formation of blood clots. Nattokinase has had numerous studies conducted on it, including a human trial. In this trial, individuals who received 200 grams of it before breakfast exhibited an increased ability to dissolve blood clots. Lumbrokinase has been used in multi-hospital studies in China. These have shown patients with unstable angina had improvements, as well as stroke patients having improved functionality. These studies indicate that lumbrokinase reduces blood viscosity. If you're on blood thinning medications, be sure to consult your healthcare practitioner first. Now, if you prefer not to take supplements, you might be more interested in using what's on the end of your fork to improve your blood flow. Number 2. Eat plants. Consuming foods that are nutrient-dense can help improve the health of your blood. For example, foods rich in vitamin E are important to consume. Vitamin E is recognised for its blood-thinning effects. When it is taken orally, it can reduce the platelet accumulation by improving the sensitivity to prostaglandin E1. In other words, it's a platelet-reducing fatty acid. Examples of these foods are sunflower seeds, almonds, Brazil nuts, mango, and avocado. A further food that contains vitamin E along with other clot-busting compounds is cayenne pepper. This contains capsaicin and salicylate. Studies have found that capsaicin can help to clear away fatty deposits that narrow arteries, as well as assisting to dilate arteries and blood vessels to clear away clots. Salicylate is a natural acid which can also help to thin the blood. Another food that is beneficial for blood is beets. These can help with blood pressure due to the nitrates found in them. The nitrites help the body produce something called nitric oxide. Nitric oxide aids blood vessels to dilate, making it easier for blood to flow. Furthermore, beets have been found to help prevent the aggregation of platelets. We're about to unveil the number 1 way to help prevent blood clots, and discover the role a certain vitamin can play in preventing heart disease. But before we do, are you ready for 2 free gifts? Find out everything you need to know to prevent heart disease with our free ebook, The Surprising Truth About Fat and Cholesterol. Plus, get exclusive insights from some of the world's leading medical and nutritional professionals by watching the first episode of The Untold Story of Heart Disease. Both gifts can be grabbed simply by clicking the link in the description below. So go and claim them for free. Number 1. Sunshine. Finally, did you know that something as simple as getting out in the sun could help prevent blood clots? Our body makes vitamin D from the ultraviolet rays of the sun. People with the highest level of vitamin D have the lowest risk of blood clotting. Interestingly, researcher Gerald Pollack, PhD, discovered something he called the exclusion zone. He found that the sun makes blood vessels smooth. It creates an area between blood flow and the blood vessel wall. The larger the area, the better the flow, and the more sunshine, the bigger the exclusion zone. This explains why cardiovascular disease is less prevalent in those with higher levels of vitamin D. It is a fat-soluble vitamin and hormone that is synthesized by the body from the ultraviolet rays of the sun. However, we can also get it from certain foods such as fatty fish, cheese, and eggs. Vitamin D, directly or indirectly, controls the expression of several genes responsible for the regulation of several processes which have relevance to blood clotting. Therefore, having good levels of vitamin D can play a crucial role in preventing blood clots. The best and cheapest way to do this is by getting out in the sun between 11 a.m. and 3 p.m. However, during the winter in certain parts of the world, there isn't enough sunlight to make vitamin D. Thus, it's important to eat foods rich in vitamin D, and in some cases, a supplement may be needed. A bonus about taking vitamin D supplements is that both the National Institutes of Health Office of Dietary Supplements and the Agency for Healthcare Research and Quality do not list any negative interactions between vitamin D supplements and blood-thinning medications. So, on the most part, it is safe to take a supplement if you're on blood thinners. However, always be sure to check with your health practitioner prior to starting new supplements. So there you have it, how to recognise symptoms of a blood clot, plus the top 5 ways to prevent them. Which of the symptoms surprised you most? And what are you going to do to avoid blood clots? Let our community know in the comments below. And before you leave, make sure to claim your free gifts by clicking the link in the description below. And don't forget to subscribe to our Heart Disease Code channel and hit that bell button for more help managing your blood health. Thanks for watching. Have a heart-healthy day.